Hey, Doctor Yates here, and I just had a little bit of a gap before starting patients for the day, and I was going through some of the posts on this group, and one of them had a lot of questions about all the different symptoms that no one's prepared you for during menopause. So I'm going to go through every single symptom and concern and answer all of them right now to the best of my ability. Keep in mind, you will be hearing the word low progesterone a lot. Let's dive in. I will not be saying any names or anything like that. Everything will be staying confidential. All right, we'll start off. Heart palpitations and lightheadedness. I thought I was literally dying. I never anticipated this was Perry. Yes, the heart palpitations is something that they do not talk about, and it happens all the time. And in this group and other perimenopause groups that I'm a part of, it's one of the main things that people post about. With progesterone dropping, that does happen. That being said, anytime you're dealing with heart symptoms, you shouldn't never put all of your eggs in one basket. Get your heart checked out first. Make sure that there's no anything else to be contributing. But I've always found that by getting the progesterone addressed and then adding magnesium and electrolytes, that helps a lot. If you have low iron, you want to make sure you get that ruled out. And if you have low blood pressure, that's important too, which can be tying in with the electrolytes. But all of those can be contributing to the palpitations. Next one. The concern they never thought that they'd be waking up drenched in sweat every day. This is not typically thought of as much in early perimenopause because a lot of people think that night sweats is just low estrogen, but it's not. Low progesterone can cause night sweats as well. So I've seen a lot of cases of night sweats in early perimenopause, even though they still have high levels of estrogen. But I've also seen it in later stages of perimenopause. So the answer for this one, it does depend on knowing where you are in perimenopause in terms of what's going to be the best treatment for that. Someone says their concerns are all the symptoms. That's a little more vague. And then we have heart palpitations again, as we already discussed. Okay, someone said, let me see, ladies in this group, we warned us about the change of the birds and bees and getting our period. They didn't warn us about early menopause, and I think we should talk to our daughters just as much as everything else as I started to talk to my 18-year-old about menopause. So when she is my age, she will not know what I didn't, and she's not going to feel like she goes crazy when her time comes. I think that is fantastic advice. You giving people knowledge in advance, like most people on here are all getting shocked by these symptoms that they never thought would happen. If pass that information on, and now that's the great thing about this age of information is that we can all be aware. Next one, we have sweat and hot flashes, which we discussed. Insomnia. Insomnia is a big one when it comes to perimenopause. Probably one of the biggest symptoms, because when your sleep is off, everything is off. Now, when it comes to dealing with the insomnia, typically in perimenopause, the sleep disturbance is not always problems falling asleep, it's problems staying asleep. And especially if that problem staying asleep is always happening about a week or two before your period, when you're getting your period. That is definitely a perimenopausal symptom, definitely linked with low progesterone. There's other things that you can do to help improve your sleep, reducing caffeine, increasing magnesium. And again, if your problem is falling asleep initially, it might be because of stress or something else. That's where using some gentle sleep aids could be helpful. And if it's not waking up in the middle of the night, but you're waking up at say 4 or 5 in the morning, that type of sleep disturbance is related to cortisol. So that's typically related to stress. If you're under more stress and your cortisol comes up around 4 or 5 in the morning, if it goes too high, it will wake you up. So we're looking for that sleep disturbance of around typically 1 to 3 a.m. That is a very classic perimenopausal sleep disturbance. The next concern was rage. Yeah, the irritability. I've had a lot of females come into this office and say, like, if you don't help me, I'm getting divorced right now. People can't stand me. I can't stand them. They just feel like this. They always say it's just like a short fuse that's ready to go off. And it's not all the time. A lot of times, depending on early stage, it's like PMS and then it's like PMS, but way worse. And then it's PMS that's way worse and way longer. And it just keeps kind of dragging out. Yes, progesterone will play a big role for that. I have found personally that for my clients that by adding acupuncture, so if there's an acupuncturist around you, that really helps speed up the process. And there's herbal formulas that we use. A lot of you have things that contain bupleurum and peony really help with that rage. Really helps speed it up. But you still have to make sure you get the progesterone addressed. And of course, If there's any help that you need in terms of stress management, cognitive behavioral therapy is also a very good idea. Exercise actually is a very good idea to help with that rage, but exercise on its own for perimenopausal rage typically is not going to be enough to cut it. The anxiety is on another level. The anxiety does typically get a lot worse, and you'll start to see overlaps in everything I'm saying. Progesterone is the calming hormone. So for some people, low progesterone leads to anxiety. Some people, it leads to just anger and irritability. We're still dealing with that low progesterone. And again, magnesium can be helpful for that as well. Exercise and acupuncture the treatment for anxiety and irritability, even though they're very different, the treatment in perimenopause is so similar. Even the acupuncture point protocols are almost the same. What do we have here? All of them. I thought menopause was going to be difficult. I never heard of the language of perimenopause until symptoms hit me like a massive tidal wave. Oh, they were not prepared for the direct relationship declining progesterone and a massive increase in anxiety. Yeah. As I mentioned before, but the big thing is just get your progesterone levels back. We have another one for rage. Brain fog, anxiety, and dizziness. And as of this month, 2 periods, not even a week apart. So this is where you start seeing moving into the second phase of perimenopause. The brain fog in later perimenopause is typically related as estrogen levels decline later in perimenopause. But in this stage of perimenopause, where the periods are getting more frequent, you would want to know if the brain fog is going to be related to diet. If they're getting 2 periods a month, are you losing too much iron? Same for the dizziness. If you're getting the dizziness and you're having 2 periods a month, you definitely want to make sure you're getting your iron levels checked because you're bleeding more than you should be. And they mentioned the anxiety, and that part would be the same, getting the progesterone addressed. As your progesterone levels drop, progesterone is what helps prevent the uterine lining from getting too thick. And so then the thicker it gets, the more bleeding that you have. At the same time, if you're getting 2 periods in a month, it was probably a cycle that you weren't ovulating at all. And in which case you would have been if you're not ovulating, you're not producing your own progesterone, and it's tanking quick. Heart palpitations and the rushes of adrenaline. We've addressed that. Itchy ears. So for itchy ears, as your progesterone levels drop, in a lot of cases, especially in the first 2 stages of perimenopause, your estrogen levels aren't declining along with it. They can stay the same. They can be going up, and they're doing these waves. When estrogen levels get too high, histamine levels jump up with it. And when histamine levels jump up, you can get a lot of things like itchy skin, itchy ears, all of those things. So what you want to do is help your body detoxify excess estrogen metabolites, bring the progesterone levels back up, and then you can use a natural antihistamine. I don't encourage people using high-dose antihistamine medications for long-term because there's too many side effects associated with that, but you can use natural antihistamine medications. A really basic example would be like, say, nettle tea, and that can help pull the histamine levels down and correct these symptoms. Okay, what else do we have here? Vertigo and feeling off balance, muscle and joint stiffness, headaches, jaw muscle pain. Allergies have been so bad. As I just mentioned before about the elevated histamine, that all ties in with that. On and off heart palpitations we discussed. And on and off hot flashes, and they just keep adding symptoms. In terms of the vertigo and feeling off balance, that can be for a few different things. If you're getting the muscle and joint stiffness and the headaches and the jaw pain, that can contribute to the vertigo and feeling off balance. If you're getting more heavy periods and low iron, that can contribute to the vertigo and feeling off balance. If you have low blood pressure, that can contribute to the feeling off balance. And the progesterone on its own can contribute to that. So there's a handful of things to be checking there. Waking up the second after I've fallen asleep, my entire body buzzing, thinking I'm dying. Yeah, waking up in those situations, like we said, with the low progesterone is a big factor. And then in terms of that, like you said, it's that wired feeling. The adding progesterone and magnesium is very helpful for that. Making sure that you're pulling back on caffeine. If you're having a lot of caffeine, if you're having any type of sleep disturbances, you need to pull your caffeine levels way down. And that includes even healthy caffeine type things like green tea. Night sweats, feeling like you're on fire, that would be the same as addressing for the hot flashes. It could be estrogen, but depending on the stage of perimenopause, it's probably progesterone. There are a lot of herbs that you can use for hot flashes and night sweats. When I started practice, like the very, very early in my practice for the first couple of years, naturopaths where I practiced weren't allowed to use bioidentical hormones yet. So we treated everything with herbal formulas. And there are herbs that work well for hot flashes and night sweats. But once we got to the bioidentical hormones, they corrected so many other things that I predominantly just use bioidentical hormones. I know people used to list things like sage tea, black cohosh. I've never personally found that when I was using those herbs in practice that they helped very much. There are other herbs that I found that were quite helpful. Scutellaria bicalensis, Dong Quai. I put together a formula of those, sometimes with a little bit of lady's mantle, and that I found consistent, but you have to dose it quite high. So just using the bioidentical hormones is so much easier. If you're in a situation though, say that you've had an estrogen positive or progesterone positive type of cancer, and you can definitely not use any hormones, then you might want to consider those. All right, what else do we got? The intense itching that burns almost, we've talked about that. Starting to get allergies. You can see more people getting allergies is because of these increased histamine levels we talked about. Periods becoming much worse. Let's see, never really had cramps. Size of the clots are ridiculous. Basically, as the bleeding gets heavier, the clots get bigger. And as the progesterone drops and the uterine lining gets thicker because of that, you'll see heavier periods, more painful periods. Okay, awful chills, feeling horrendous, fear for nothing all day. That would go along with the anxiety. The itching drives insane. We discussed that. Stomach issues is the big problem for this one. That one's not as specific, and I wouldn't feel comfortable saying it's just related to perimenopause without more context, because there's so many issues that, from a naturopathic perspective, I see that contribute to stomach issues that wouldn't be a fair statement. Anger, hungry. A lot of times for the hormones, correcting the hormones makes a big difference for cravings, but a lot of times with the cravings, people are deficient. So, for instance, we use a formula for clients in the weight loss program, and it basically has a lot of minerals, a lot of the different amino acids in it. And when we give people that, their cravings typically drop. Same with magnesium. So you want to make sure that you're getting, a good diet with lots of minerals and vitamins, and you can see the hunger decrease with that. Anxiety, heart palpitations, we discussed. Everything is a mess. I'm sore. I'm lost. I'm depressed. I'm sorry to hear that. In terms of the soreness, the dropping in progesterone leads to a lot of muscle tension, especially around the larger muscle groups and weight-bearing muscle groups. So hips and thighs can become extremely achy. Shoulders is another big one. Seeing frozen shoulder in perimenopause is extremely common. And then unfortunately, the mood changes along with it. Crying, depression. And again, hormones will absolutely play a role with that, but I don't think it's fair to put all of the eggs in one basket for that. You want to make sure that you're getting other therapies and help done, just to make sure, again, that you're not putting all your eggs in one basket. Okay, let me see here. Weight gain. Yeah, weight gain is a big one. And honestly, when it comes to perimenopause, you have to reset your expectations. You can lose weight in perimenopause with the right diet, with the right hormone balance, and with the right exercise program. You definitely can lose weight, but it will be slower even when you're supplementing with the progesterone. But you have to the more you get that estrogen progesterone imbalance, the more weight gain that you will have, and it will be different than the weight gain you've had before. It will typically be more around your midsection, less around your hips and chest, like it might have been before. It starts switching all to like that midsection weight gain. Joint pain. Now, for joint pain, yes, hormones play a role, but you're also at a stage that the hormones will affect how your body responds to diet. You really want to start switching to a lower sugar, lower processed food diet, more of an anti-inflammatory diet. And if you do that, plus work with the hormone balance, you could see a much bigger reduction in joint pain. So really pulling back on inflammatory foods makes a huge difference. Okay, anxiety, heart palpitations, discuss that. Joint pain, discuss. Body temperature irregularity, yep. Achy joints, acid reflux and indigestion. Okay, one tip I would say that's not related to perimenopause, but is related to acid reflux and indigestion, is that a lot of times the position of someone's stomach, and I do see this happens more with, I hate to say it, but more with age than necessarily the hormone changes. But when you get a lot of cases of acid reflux, I see this helps very consistently and very quickly. If this is your stomach and this is your diaphragm, it's not uncommon that the stomach gets pushed up a little bit, and that pushing up through the diaphragm affects the sphincter so that you can get, if you start getting acid reflux, like you could just be getting to the point where you eat small meals, you get acid reflux. You're not eating spicy foods, you get acid reflux. You drink water, you're getting acid reflux. Think more of the position of your stomach, and it's a simple adjustment where an osteopath should be able to, hopefully if there's an osteopath near you or a well-trained massage therapist, but as you breathe in and the diaphragm moves down, and then as you exhale and the diaphragm comes up, someone will be pushing on your stomach and applying a slight pressure down. It is uncomfortable, but it is effective. Listen, son, that everyone said the 40s was going to be the greatest years. They lied. I think I would have made more of my 30s. Yeah, I'm not sure who said the 40s was going to be the greatest. I don't know. It's better than the alternative. It's better than the alternative. If you can, again, keep focusing on the hormone balance, keep focusing on, it is a great time in life, though, to redefine what your expectations are and what you want. It's that time in life where it's not just about the hormone changes. It's for men and women, it's that time when you have to make that decision, like, I did this before because this is what I had to do, but now what do I want to do more of what I want to do and what's right for me in terms of how do I want to finish off this. Oh, finish off. I don't like that. I don't like that term. How do I want to do the next stage of my life? The detrimental effects that it's having on my relationship. Yeah, that's a big one. There's a lot of marriages that I've seen helped by working with mood, by working with better sleep. And then even more important than that, like that one person mentioned above, really opening up the lines of communication. A lot of people on this site, and I'll say this from a practitioner who's been dealing with this for a long time, and I'll say that from a male. A lot of people on this site, these are all things that you had no idea that would be affecting you in perimenopause, which means that your partner definitely has no, like not even the slightest idea. So if you're not being extremely open and communicating with them, now if they're not supportive, that's unfortunate and that's a different issue. But for them to support you, just make sure you're being extremely open with them and explaining what you're experiencing and what's going on, because I guarantee if you guys are having questions, your male counterparts have not the slightest clue. So I know a lot of them will want to support you. They just have to know what you need. Vertigo and migraines. Migraines is the big one that you see, especially when it starts with that week or two before your period. When you're at that phase of perimenopause, and what's happening is as your estrogen levels go up, some people will see that with migraines, and some people will see it with breast tenderness, but it means that you need to help your body cleanse out the excess estrogen metabolites and increase your progesterone levels. And now, if it's just migraines that are starting now from perimenopause, that's one issue. But if you've had migraines since you were a kid, most of the studies indicate that pulling back on wheat can reduce most of those migraines, and that's what I've personally seen in practice as well. The level of fatigue and overall lack of interest in things I used to love, it's weird. Hormone balance plays a big difference for that. And then while you're waiting for the hormones to balance, I've seen a bit of a hack for this. I use clients, I get them B12 injections. And I use a mixture of B12 and folic acid injections, and that really helps boost people up while we're waiting for the hormones to balance. Top 5, weight gain from nowhere, brain doesn't connect to mouth. That's a big one. Yeah, the brain fog and losing. People always feel like the words are on the tip of their tongue and they can't get it out. You will see that improve again by pulling back, changing your diet to a lower sugar diet, and correcting the hormones. That is key. Heat from the inner soul, intense rage, from as little as dropping my toothbrush. Yeah, definitely you want to get the hormones balanced and look into getting some of the acupuncture done. And I have a program to teach people with these little acupuncture needles. And I know a lot of people, depending on where you live, don't have access to these different practitioners. So I do have a program, and it just basically teaches you where to put these little acupuncture stickers so you can put them on and do the treatments on your own at home. Is anyone taking medicine for anxiety, depression? A lot of people are I would say probably a third of the clients I see are on medication for anxiety and depression. And if you've been struggling with that for a long time, then starting with medications is fine. If the symptoms only started with perimenopause, therefore the change is related to hormone balance, if you're really going to treat the underlying cause, you have to address the hormones, not just take medications for the anxiety and depression. The stench. I shower every day, more than once, being careful, eating better. I feel like I sweat all the time. Okay, so for the change in the smell, one of the things that happens is that as your progesterone levels decrease, which affects your testosterone levels or androgens, you can start seeing increased levels of certain androgens in females. This is why you will see increased body smell. You have to start smelling like a stinky boys. And you'll start seeing more increased chin hair, hair loss, male pattern hair loss. Those are all signs where you're getting increased androgens. The progesterone helps block that conversion to excess androgens. It's important that you get that addressed. There are different things that you can use from an herbal standpoint to help block that. And similar as the herbs you would use in like a PCOS case to prevent the excess androgens. And some of those ones I've already mentioned before that we use in the irritability formula, the number one being peony. Peony, nettles are helpful for that. No one prepared me for this, full stop. Yeah, that is very common. A lot of people just hits them like a ton of bricks. Anxiety, depression, mood swings, weight gain, we've discussed. Itchy ears. I'm just going to scroll through here and see if there's anything that we haven't discussed yet. And I want to make sure I've got a little bit of time before my patient comes in. So, perimenopause comes swimming. Oh, loss of libido. This is a big one, extremely common, and it's probably the one that's the slowest to treat because there's so many factors. A lot of people just want to label libido that you'll see when they're giving advice online. They're like, low libido, it's because of low estrogen. Bam, case closed. Oh, low libido, you just need testosterone. It helps. Case closed. Unfortunately, it's not that simple. There's so many factors that affect it. If your sleep sucks, you're going to have low libido. If your energy is low, you're going to have low libido. If you have increased anxiety, you're going to have low libido. If you're having relationship difficulties or problems with your partner, you will have lower libido. So all of those factors, plus dealing with the progesterone, estrogen, and testosterone, getting those ruled out, will all come into play, which is why I find it's the most, of all the symptoms, the most comprehensive thing to address it, because you're not dealing just with a hormone imbalance, you're dealing with the effect on relationship, the effect on energy, the effect on any type of deficiencies. All of those things play a role. Ear itching and mood swings. Yeah, and just to touch base on the libido while I'm scrolling through here, there are lots of herbal formulas that you can use for libido as well. The herbal formulas you use for libido are the same herbs that they would use in male formulas for libido. Sometimes they can be helpful, sometimes not so much. I would honestly say the hit rate seems like it's only around 20% when you're using things like Muropawama, Epimedium, etc. Just want to see what else we've got here. Anxiety in the middle of the night. And you can start seeing, this is one of those things, and I feel like these videos that I'm trying to put to help, because you keep saying everybody coming in with the same concerns over and over. This one's different, cracked heels. You can see skin drying out when you start to go into lower hormones, but I would also say making sure you're getting enough omega-3s and healthy fats in your diet would be pretty important for that too. Insomnia. Yeah, I think that basically would sum up. Yeah, hair on chin, we've discussed that. Joint pain and something. So you keep seeing the exact same concerns will keep coming up over and over. If you had to summarize it, you got to make sure you get the progesterone checked. You got to make sure that you're doing a diet that's lower in processed foods and sugars. That makes a big difference. And then adding some acupuncture, herbs. The magnesium's a big one. So again, you don't need to get, I have a lot of clients where they come into my office and they literally were sold a bag of about 50 supplements, and you don't need to go down that rabbit hole where you're taking, 50 different things. Honestly, this could be addressed with like some dietary changes and 3 or 4 supplements. That could do it. And we're at the bottom of the list, and it looks like there's just someone's doing some promo at the bottom. And yeah, so that covers everything that I've seen from that post. And if you have, oh wait, there's one. This is one. Air hunger before and during periods. When you see air hunger before and during periods, that is very common when you have a low iron symptom. And it typically means a lot of doctors will say, just take iron during your period. I don't find that's enough. I think that you normally have to take it more often than that. So if you get to check your iron levels, check your ferritin levels. If your ferritin levels are quite low, it can take a year of iron supplementation to bring that up. And then the next question is, if you're not having really heavy periods and you're having low iron and you're not a vegan or a vegetarian, it must be an absorption issue. Is there anything that you can do to improve your absorption so your iron levels go up better on their own from your regular diet as well? All right, Dr. Yates, I hope this was helpful. Bye.